This is Walt Culbertson. I think what you have highlighted is critical from the standpoint of how we, number one, design websites so those with disabilities can use them, to how we're going to design the patient health record and how it's accessed and how it's shared and communicated. All of those things, I think, have to be factored in. And so what you're highlighting this morning, I think, is a very, very important point that we all need to keep in mind. Not only the racial barriers that sometimes exist to understanding and using the information, but as well those disabilities. Thank you.
Very good. Thank you very much. And that does conclude our presentation for this morning. And I'd like to thank the panel members for the fine presentation and enlightening us a little bit more about health center control networks and what they can do for the other regional extension centers out there and your fine work. So thank you very much.
Thank you, Michael, and thank you to the panelists. For those of you online that submitted questions, if you didn't get your question answered, we'll provide written responses so that we want to be sure that you get the information you need as well. This will conclude today's stakeholder forum. Michael, thank you. I want to echo Kevin's sense of what an enlightening morning this was for all of us, and I know that there was much information that will cause us to go back and think differently about partners in our regional areas and local areas and how we think about things nationally. My sense is that the nation is discovering that the community health centers are one of our best sources for learning and demonstration of innovative solutions to some of our most challenging problems, not only in health IT, but in healthcare in general. Some of the advent of things like patient-centered medical home is really old news to you. You've been doing things like that for quite some time, and for a variety of reasons. Maybe it's mission and vision. Maybe it's a mandate for creativity and innovation because you've not operated with a lot of resources, or maybe it's the depth of need of the population that you serve. The community health centers have excelled in many ways, and it feels like you're positioned to excel in the same way in the future. So congratulations on the work that you've done so far, and thank you for the insights you provided today. As many of you know, the National eHealth Collaborative Board has spent 2 months engaged in strategic planning activities. After lunch today, the board will go into executive session for the next step in this important process and to hear a report from our Finance Committee. So that you can mark your calendars, the next National eHealth Collaborative Stakeholder Forum and Board of Directors meeting will be held here in Washington, D.C. on August 25th. As soon as we have additional details, we'll provide you with those via our listserv and our website. I want to take just a moment to talk about NHIN University. This has been an extremely exciting and successful stakeholder education program. If you haven't been involved in NHIN University, we would very much encourage you to explore it. The inaugural semester of NHIN University just finished its last class at the end of June, and it offered a series of free webinars, they're all free, intended to provide stakeholders with foundational knowledge about what the National Health Information Network is, how it works, and the vital trust fabric that underpins the safe and secure exchange of health information over the internet. I'm so pleased to report that we've had over 1,200 people participate in these classes and that stakeholders continue to visit the NEHC website to access recordings and transcripts from those classes. If you're interested in viewing a class from the past semester, you can find them on the NEHC website at www.nationalehealth.org/NHIN-U. NEHC is now in the process of developing a fall semester and plans to resume classes around September. Again, if you visit www.nationalehealth.org/NHIN-U, you can sign up to be notified when classes resume. So unless anyone else from the board has anything to add, I'm going to open the floor to public comments, for we just have about 1 more minute left if there are any other public comments.
I prefer to sit down. Thank you. It's more comfortable. Thank you. That was a very good idea that you had. Hello, my name is Elaine Nichols. I'm a patient advisor representative on a military base for patient family-centered care. And it's really a privilege to be here at this program, and as well as the one that I attended on Friday at the National Institutes of Health. And one of the questions, well, I have several, but I will narrow it down. I will be succinct, as I'm always told I must be succinct. Regarding the exchange of information, I'm going to ask 3 questions. First of all, is it really necessary to include monetary incentives to adopt this program? Number 2, would it be more patient-centered care to, on the list of, I'm going to bring it up here. There is the list you have here of, it's under H, there's so many acronyms. It had to do with the problem list. And I was just wondering if at an appointment, you could just drop the word problem and just have a list of things you wish to discuss with the doctor. I think it would set a better framework and increase, it would enhance communication. And then item 3, regarding a rule of, in the event, and I do patient surveys at this military base, and it's been a wonderful opportunity. I'm also a Red Cross volunteer. Often I hear of patients saying that, well, this was said about me and that was said about me and this isn't true and so on and so forth. And you're exchanging in these programs this information nationwide. And I'm wondering what kind of follow-up should a patient have that would be helpful to the patient, providers, physicians, regarding any data that may be false. And you want to, correct it, other than doing an amendment. To me, it's a very simple thing. You just go in and say, hey, I didn't say that, you wrote that down, could you please add that? You don't have to go through a big amendment process. It's very simple, and why can't that be done?
Michael, it pains me to have to do this, but I'm afraid we're going to have to answer this question offline. I am so sorry that we did not have adequate time. I was left with a list of questions as well, and your questions are rich, diverse, and they deserve an answer. Okay. So it just kills me that we can't have that discussion in here today, but we will most certainly respond to those in writing and include those because I can't wait to hear the answers to them. They're excellent.
I think it would just be helpful to me in dealing with the patients in the survey. I would like to be able to give them information that will not be a burden to them, or many times they're concerned about losing their health care or being terminated from their health care, and that is something they most want to avoid, and often they just go along and walk away, and I don't think that enhances any program involving health care.
You bring up some excellent points. So we look forward to, we'll have some time, I believe that our presenters will be here in the next so that we can get some clarity on those questions. And if we could just make sure with the staff that the answers to these questions get posted along with our online questions, because I think there are a lot of people that would very much like to hear the response. Thank you so much. At this point, we are out of time, unfortunately. Thank you all for a very productive discussion today, and thank you especially to our stakeholder forum participants for your important contributions. We look forward to continuing to partner with you in the pursuit of an efficient, secure, interoperable, nationwide health information system that will improve the health and well-being of all Americans. Hearing no objections, the session of the meeting is now adjourned. Thank you.